Do you guys know what a cluster headache is? It's like behind one of your eyes, makes your eyes water and all of that thing. I had one yesterday and I'm having one right now and it's killing me. I popped some pills. I thought it was because I wasn't wearing my glasses, so I put my glasses on. It is not helping. This better go away. I gotta get to the doctor's office in 2 hours. Ow. Okay, my head is feeling a little better. I just opened this. I'm about to put it in my bag. It's like a tip an upperclassman gave me for your white coat. If anything spills on it, just dab this on really quickly. You look professional, and getting the stain out later will be easier. Or I don't know if this takes out the stain completely. Oh, instant stain remover. Okay, maybe I should have read it. Alright guys, don't mind how I look. You guys know I get dressed in the car, or you should know by now if you've been watching these videos. I'm on my way to pick up my carpool buddy. I'm thinking about starting clinicals today. I've heard mixed reviews. I've heard people come out of them feeling like, whoa, I could be a doctor, you know, that was amazing. I feel so encouraged. I feel so much more confident in my skills. And I've heard other people say it's crap. Like, that's it. I said, how's clinicals? They said it's crap. So, very different reviews. I guess it depends on where you go and who the doctor you're working with is. Can't wait to see how my experience goes. What is exciting though is that they're real patients. I'm not sure if you guys know that, but in med school, the patients you see are hired. They're hired actors. They don't actually have these symptoms or feelings. Wow, there's a lot of traffic today. Probably should have left earlier. It usually does not take me this long to get out of the neighborhood. What was I saying? Yeah, it's just cool to know that these are real people. It's cool and it's scary because it's real people. They're not faking this. They're not acting. So I just put my pins on. Look how white the coat looks. Golly. I always wear a Dominican pin. It's a conversation starter. Plus I like to rep my country. I don't know if I'm gonna keep my hair down or not. I'm probably gonna put it up. But aren't you so excited? Oh my God! Our first day of clinicals. Look how cool this plaza looks. Every doctor has their name on the building. Alright guys, this is basically how we look. ID, pens. I have my stethoscope in my pocket. I don't really do the neck thing. It's kind of douchey. And your notepad. Okay guys, so he's not at this office. He's at his other office, but like, we're not late or anything. This is where they told us to go and he forgot and he's at his other office. So now we're gonna go there. So yeah. Okay, starting clinical rotations, take 2. Okay guys, we're on lunch. How do you feel?
I feel awesome. I learned so much.
This doctor
I would do this all day.
This doctor is awesome. Like, not only are we seeing, we saw 6 patients, 7 patients. Between the patients, we're learning. Like, we're going over EKGs, we're going over physiology, endocrinology, like everything. It's so awesome. We're walking and eating because it's really cold in there and we want some warmth. And then we're going back in. Man, this bump looks big. I'm just tired. Tired on day 1, Monday. And
it's the first time. It's the first time
lunchtime.
to actually walk around like this.
The hustle is real too. When he's like, come to this room, I'm like, hustle, speed walking.
Because you have to ride, you have to concentrate on what is being said because, you know, seems like he's popping questions randomly. And sometimes it's not even related.
Oh, I got a question about squamous cell carcinoma.
Shit.
When the patient came in, it was like a checkup. The patient had 2 mechanical valve replacements and complication with COPD. And the question he asked me was about squamous cell carcinoma. Because he said, look at this thing on her eyebrow, and he made me feel it. And it was actinic keratosis. And I was like, oh, she could have squamous cell carcinoma. And he's like, she does have squamous cell carcinoma. And I'm like, how do you know? Because all I can see is the keratosis, you know? And the treatment is freezing, by the way, in case you were interested. By the way, in case some of you are wondering why there's no ACLS video, it's because I couldn't record anything. Like, anything. So, sorry. Hey guys. Just gassing up the car right now, probably gonna get a car wash. Okay guys, I just dropped off my carpool buddy, so let's talk. The day went by so quickly. We saw patients individually. So personally, I saw 8 patients, I believe, all female except for 1 male at the end. Everyone I saw with him, with the doctor, were follow-up patients, so there was no like introduction and finding out family history, social history, things like that that you do on a first-time patient interview. I didn't get any experience with that because, you know, they're all follow-up patients. I was just following him around. The reason we weren't allowed to do any patients on our own is because we went to Miami, Hialeah specifically. So that is a very big Spanish-speaking community, and all of his patients were Spanish-speaking. Some of them could speak English, but Spanish was their first language, so it's easier for them to understand more in Spanish. So we weren't able to interview patients on our own because our Spanish is very basic. I communicated with patients, but I wouldn't be able to do an entire medical interview with my basic Spanish. As far as what I was able to do, the only thing I did was do an EKG on a woman, wipe down the areas of the skin where you want to put the leads, and the machine does all the work. So you just put in the leads exactly where they're supposed to be. I'll post a picture of where you're supposed to put the leads right here. So I did that, ran it for a woman. She had breast cancer. She got a mastectomy 5 years ago. She's on these meds, these oral chemotherapy meds that are giving her some side effects. She said the biggest side effect that affects her is insomnia. The doctor prescribed melatonin just to help her out with that. He gave us a lot of stuff to research, a lot of questions. My doctor is not a cardiologist or anything, but there were a lot of cardio questions. He said prepare tomorrow for a lot of respiratory questions, so that's what I'll do tonight. Oh my gosh, you just have to know everything with internal medicine. It was so awesome, guys. I'm not really interested in going into internal medicine, but doing the rotation was so awesome. Seeing so many patients, it was so quick. Like, we saw not quick as in the patient visit was quick, but quick as in you saw so many patients. Like, as soon as I got back to the office, I was pulled back out of the office to go see another patient. Between patients, I would try to research things because he would ask you questions while you're in the patient room. So if there was anything I didn't know or needed clarification on, I would take out my phone in between the patients and try to research and Google and look in my textbook. But you didn't really have time to do all that because up next was another patient. So wow. I even asked the receptionist if it's usually that busy, and she's like, today was a slow day. So tomorrow is going to be so real. I'm kind of tired, but I'm kind of hype. You know what I mean? Like, my body feels tired, but my brain is so excited to start all these things. Okay, guys, I just ran into Walmart as usual to buy a bag of apples and bananas. Keep my fruits up. I've already cooked, so no need to buy groceries. Okay guys, the rest of the day I'll be studying and looking up the stuff that the doctor told me to look up so we can discuss tomorrow. He wants the first week that we meet to be about cardio and pulmonary, so today we did a lot of cardio, a lot of EKGs, and tomorrow he told us to look up the difference between COPD and asthma so we can have a hearty discussion on it. So that's what I'll be doing. I'm gonna end the vlog right here, guys. Thank you so much for watching. I'll see you guys tomorrow. Remember to like and subscribe, comment, and share.